you will be given a treatment or education notice by the police. This is in line with the government's own crime prevention strategy, which is all about early intervention. This is in line with the police's drug strategy, which again is about focusing on criminals, traffickers, manufacturers, and helping people who use drugs. We know that the majority of people who use drugs actually don't have a problem with them. But this could provide that crucial early intervention. This could provide a change to someone's life if they were going down a trajectory that was going to end them in trouble with drugs. So this is sensible, this is reasonable, this is not radical. This is what other countries are doing, and the evidence tells us that we should be doing it in Victoria. And I'm so pleased to be joined by people who are at the front line, people who have had lived experience with the current laws. And today we have Patrick from First Step, we have Andrew from YSAS, and we have Baden, who has lived this and understands how important this change is. So I might bring Patrick on first, and then Baden, and then Andrew from YSAS. And then Paul from HACSU, who represents all of the unions and all of the people who are working at the front line.
Thanks, Fiona. Firstly, thanks again for organising this birthday party for me. I greatly appreciate it. My first press conference. My name's Patrick Lawrence. I'm the CEO of First Step, which is a addiction, mental health and legal services hub in St Kilda. At First Step, we work in a really challenging environment. And that environment is made infinitely harder by the world's greatest public policy failure, the war on drugs. In my 20 years of working in the alcohol and other drug sector, I'm yet to meet a single adult who's struggling with addiction who has not been using drugs to manage their own pain and trauma. The greatest impact of our current drug laws is not on the recreational user. It's actually on the most vulnerable people in our community. We're talking about adults who've survived childhood traumas, childhood abuse and neglect, homelessness, poverty, and the absence of love and the absence of bonding. Most of us would move mountains to prevent harm occurring to a child. We'd leap Paddy Dangerfield-like into the surf. So I ask you, at what age does an adult no longer warrant? When are they no longer worthy of our compassion and of our moral courage and of that kind of heroism that we would give to the child? Empower police to direct people to treatment, to support and to education instead of arresting them. That's actually all we're asking for. We're asking for a change to the diversionary powers of police from being discretionary to being the new normal. It's pretty simple. Yes, of course it will need resourcing of the drug and alcohol sector, like any significant policy change, but can you imagine the funds that will be freed up from the criminal justice system in a society that prioritises health, not harm? And that will benefit every single one of us. Everybody deserves every chance to turn their lives around, and this bill aims to enable just that. You're going to hear from Baden in a moment, and you're going to hear... Shall I wait for a moment? It's going to be a while? Okay. You're going to hear from Baden in a moment, and you're going to hear that the law did not help break his cycle of addiction and trauma. Quite the opposite. But treatment did. Welcome, empathy and hope did. The evidence tells us that Baden's example is actually typical, and that this bill will not increase the amount of drugs used in our society, but will increase access to treatment and will increase the chance of new beginnings. If we could design it again, knowing what we know now, does anyone think we would design a system like this, where thousands of people with mental health and addiction issues languish in prison and are in our court systems, where both recreational users and heavy drug users with significant addictions receive criminal sanctions. We all know it's madness. So it's up to the people in this building, in this place of great power and of great privilege, to listen to lived experience, to study the evidence and to talk with the experts and then make a decision. To say that it's not a priority is simply not an answer. So be tough on crime, but let's have a rethink about what a criminal is. And if a criminal is anyone who uses illicit drugs, then 40% of the population of Australia and of the Western world are criminals, including Grace Tame, including Bill Clinton, including me. And that would be funny if the ramifications weren't quite so tragic. Thank you. If there are any questions for me, shoot it. Otherwise, I'll introduce Baden.
We might let Baden speak and then we'll
Great.
open to questions. Thanks, Patrick.
Hi everyone, I'm Baden and I'm a drug addict. I am in recovery now, but I suffered with drug addiction for 20 years and it was absolute hell. There were many criminal justice interventions over that 20 years and they did nothing but cause trauma and resentment and fueled my drug use. My drug addiction was like having a broken leg, breaking my leg, and the criminal justice system came along and broke my arm to try and teach me not to break my leg again. What has worked for me has been treatment, like at the Reset Life program at First Step in St Kilda. That is what really helped turn my life around. And I work in the sector now. I work in the AOD sector because I truly believe it works. I've experienced it working, and if I thought that the criminal justice system helped people with drug addiction, I would have looked for work in that area, but it definitely doesn't. If you'll let me speak.
Andrew.
Hi, my name's Andrew Broon. I'm the CEO of the Youth Support and Advocacy Service, known as YSAS. We are the largest provider of alcohol and other drug treatment in Victoria for young people. And I've got a simple message, and that is that criminalising drug use and possession will only serve to disrupt young people's development and life opportunities. And what we're really on about, and what this drug reform bill is on about, is enabling young people to learn from their experiences and develop well. So I come to you as a CEO of a big community service organisation, but also the parent of an 18-year-old young woman. And if she was to be using cannabis and came to the attention of the law, I would like her to have an opportunity to learn from her experience and develop and be supported. So I think this is sensible and incremental reform, and I call on both of the major political parties to support the Reason Party in this case. Thank you.
Hello, I'm Paul Healy, State Secretary of the Health and Community Services Union. Our members see every day people with addictions and what happens to them. We say this is a great bill. We want to make sure it continues. We've got to continue to build our services, build that support, and ensure that every person that needs help gets it. And they've diverted away from the criminal justice system. We don't want to traumatise or brutalise anyone more. We want to get treatment, get help, and prevent it at an early stage. Thank you.
Any questions?
Fiona, how much of this is about fighting a stigma in the community? I think judges and lawyers know that drug users aren't all bad people. How much is this about getting that message out to the community?
This is so important. We know that as 26,000 people are arrested every year in Victoria for using or possessing a small amount of drugs. And the stigma around that is fatal. You know, it prevents people from seeking help. It prevents people from speaking to their GP. And I was so pleased to hear this morning that the Royal College of GPs has come out in support of this legislation because they understand it will address that stigma. It will assist people to get treatment, to get help, and to get the help that they need.
Given how long it took for alcohol and that reform to happen around it, do you think that this can happen sooner with drugs?
This has to happen sooner. This is something that we all agree on. It's hard to find someone who disagrees with this policy, except for possibly in this place. But outside in the real world, everybody understands that treating drug use as a health issue is by far the most successful model. So I would hope that we will see this change. And it really reflects the diversion that we're already doing, the discretionary diversion that we're already doing. The police understand this. This is just going to mean that there is equality in that diversion, that everyone gets that opportunity to seek treatment, that everyone gets that opportunity to have an intervention in their life that could change their life.
Fiona, if this is knocked back in the Parliament as expected, what's the next step? Could you refer this to an independent body, like, say, the Australian Law Reform Commission or something like that?
I think if the Victorian Law Reform Commission was to look at this, it would be a very short and sharp report, because the evidence, the research is all there. We know that this is the right path. Now, I hope, and we've been having fruitful conversations, I hope that when this bill is finally debated in the House, that we will actually see positive steps towards ensuring that anyone who needs help is not sent to prison, but they're sent to treatment.
Could other bits of legislation be contingent on support for this legislation?
Look, there's no reason in some ways why we couldn't do this without legislation. We could just say to police, there is no discretion in diversion. But this legislation really establishes that that is the policy of this community and this state.
Do you accept that there may be instances where police do need discretion to charge people, just the other side of the argument as well, that it's not always completely sort of clear-cut in these matters?
Look, if someone is committing another crime other than using drugs, well, then the police should take action, and they do. But what we know now is that 26,000 people every year are arrested just for using or possessing a small amount of drugs. No other crime, just that.
Fiona, you mentioned some people use drugs, have no problem with using drugs. What would happen to those sorts of uses under your
Under this, we would see education. We would see possibly an early intervention, because some people may think that they are fine using drugs recreationally, they have no problem, it's a weekend thing, but in actual fact, it can turn into a problem. So this provides that early intervention, it provides education.
Are you confident in the flow on of this, in terms of the services that people would then be diverting to? Do we have capacity there? We often talk about anything that's related to mental health or support like this is overrun with demand.
We certainly need to build up our AOD service, and I think probably Paul has some pretty good numbers on that. I'm like,
No, she tricked me here, no. Look, there is, through the Royal Commission, we've seen further investment, and we've seen doubling of the beds in Victoria, but starts from a very low base. We need to continue to build that, and we also need to increase the amount of detox beds in communities so we can get people in for rapid treatment. So it is very starting off a low base. There is an emphasis to invest in it, but there's always more we can do, and we're really excited. There's more scholarships coming into the sector to actually train and develop people. So it's growing very well, but there's more work to be done, and we're looking forward to seeing it happen.
Do you think there is a risk that if we are handing out these diversions, that you say 26,000 people, that's a lot of extra people that would be given a diversion? Do they then get lost in the system though if we don't have capacity on the back end to be supporting them?
I should hope not. And I would imagine that this would operate as a triage system. So first call is to assess that person as to what level of assistance they might need or what level of education they might need. I think we are equipped to do that. Yes, we may need more we do need more investment in our alcohol and other drug sector, but think of the funds that will be saved by taking this option instead of the criminal option that we do now.
Fiona, how does this work in other jurisdictions? I know Portugal introduced it in the early 2000s. What happens in Portugal, for example?
Yep. Our death by overdose accidental death by overdose in Victoria far exceeds our road toll. That is not the case in Portugal. They have a very low overdose rate. So this will save lives, and we have seen that evidence in Portugal. When they did this over 20 years ago, we saw far more people going into treatment. People are still using drugs in Portugal, but they're doing it more safely. And I think most importantly, they're doing it at an older age. This has changed the time that people use drugs, and that is crucial to ensuring that they don't have problematic use.
Both major parties have indicated that they're not for turning on this issue. Generally with these kinds of issues, change has to come from within. Are you talking to individuals in the major parties, and are there people who are sympathetic to your views?
Yeah. Yes, I am I'm having some very interesting and I'd say positive conversations. Look, I think most people privately understand that if this was their child, if this was their brother, if this was their father, they would want a health intervention, not a criminal one. They understand it, they understand the evidence, they understand this is the right way. Now, if we look at other measures that we have pushed through this House, like safe access zones, supervised injecting room, voluntary assisted dying, we started from a position where no one wanted to support it to a position where everyone supported it.
What do you think's motivating the major parties' positions on this?
I think they're motivating each other. You know, no one wants to have a law and order election, or maybe they do. So they are hoping that they can wedge each other. This needs bipartisan support. That is what we've seen in other jurisdictions, like Portugal, for example. There was bipartisan support. Everyone understood that this was a sensible and reasonable measure, that this made sense economically, morally it made sense, and certainly it makes sense to save Victorians' lives.
So where you're at right now with the numbers, where do you think you stand, and are you willing to sort of hold off and maybe let people come around a bit longer, or?
I've got 2 weeks to change this. But when I've got people like the unions, when we've got people like Baden being able to tell us this, when I've got people like the Royal College of GPs saying this has to change, the Alliance of Lawyers saying this has to change, we will see more and more people coming out supporting this really important change. I think it will be hard for both parties to ignore that, and it will be very difficult for them to ignore the calls from the community for change.
Fiona, just while you're there, what's your stance or view on the housing tax that the Treasurer announced on Friday in the social bill? The Premier this morning indicated that it may not even be moved in Parliament, but what would your stance be on the early detail?
I chaired the homelessness inquiry, and I am brutally aware about the housing crisis that we have in Victoria, that every night tens of thousands of people have unstable housing. We recommended that there be inclusionary zoning, and this was supported by a large number of people, stakeholders in Victoria. So this levy does go towards that. I haven't seen the detail of it, so I'll hold my decision until we see the detail, until we see what will be presented to us in Parliament.
Have you told the government that you were guaranteed to support it?
I haven't been asked.
Do you know if they've been doing consultation with other crossbenchers?
I don't think. No, I'm not aware. I'm certainly aware of I've got the glossy brochures about this levy, but I certainly haven't seen the detail of it.
I know it's been pulled. Sorry,
Hey.
they haven't told you it's been pulled.
No, they haven't told me it's been pulled. Probably above my pay grade, and I don't get invited to cabinet at all, ever, even on my birthday. Thank you.